Okay, we're back from the break, and thank you for tuning in tonight. Let's go start talking again. We do have the phone number that's going to be placed up there, 727-8750, and feel free to call in with any questions or comments or anything you want. One of the things that tends to spark good conversation is questions, and if you have a question about anything, it doesn't have to be related to anything I'm talking about. With regards to medicine or anything, then feel free to call in. I have seen a few people in town that say they like some of my political stances, but I try not to use this as a political sounding area. But I'm never short for words on mixing politics and medicine. It's unfortunate, but one of the things we were talking about at the break, and I want to say he's not on the screen, but he's in the background all the time, is Patrick. Patrick helps me a lot with this show, and you're there in their home not really understanding how this all works, but there's somebody very important behind that you can't see that tells me when we're going to break and keeps me in line. So that's how this show goes very smoothly. But anyway, Patrick was talking about being professional and how doctors over time went from wearing coats and ties and lab coats, and a lot of them still do. But one patient asked me, so when did you stop wearing coats and ties? And I said, when you started choosing your doctor over a $10 bill. And what that meant is that, when you started looking in a book to find your doctor because your insurance company told you that's who you could go to, that took a lot of the steam out of this so-called doctor's office thing. And I think over time it's a good thing because we are just people just like you. And some of the commercials I've seen on TV about health grades and things of that nature, I think that's really a bad thing. You get a name from someone, a physician that you've seen, that's probably one of the best ways to actually pick your physician, because word of mouth is probably going to be about 85% accurate. Granted, not everybody fits everybody's bill. So with that being said, let's talk a little bit. I want to bring up this slide about smoking cessation. One of the things we want to talk about is when you're going to quit, one of the important things is to set a date at which you're going to quit. It's important in your mind to think about a date that you want to quit and prepare yourself for that process. A lot of people get scared into quitting when they have an illness or they have a heart attack or they have something. But that's not, you usually find those people are back to smoking as soon as they feel safe again. Being an ex-smoker myself, I know I've quit 2 or 3 times in my life. The third time has been the last time that I quit smoking, and that was probably close to 28 to 30 years ago. And I quit cold turkey because I had allergies, and the allergies were built up by the nicotine and all the other stuff that I was breathing, and it was very difficult to breathe. And I said, this is absolutely a bunch of you-know-what, and I threw the pack of cigarettes out and never looked back. But it taught me a lot about quitting, and nicotine dependency is what your body becomes used to. But that's different than the nicotine addiction side, and it's very important to understand addiction from dependency. Dependency yields withdrawals, and that you'll see is that, and it says the addiction process, that's actually kind of incorrect, but nicotine really, the dependency begins when nicotine acts on the nicotine receptors. And the neurotransmitters such as dopamine, glutamine, and gamma-aminobutyric acid are some of those neurotransmitters that are actually released by the nicotine when it stimulates that receptor. Dopamine, of which being probably one of the biggest pleasure, it is actually a pleasure neurotransmitter, and that's very important in cocaine addiction. One of the things that cocaine does is it secretes a lot of dopamine, and Parkinson's is a lack of dopamine in your brain. And so that doesn't mean if you're a cocaine addict that you're going to develop Parkinson's. No, it's the cells that make dopamine that are wiped out in a Parkinson's patient. Really sad story, and I don't want to digress too much. There was a pharmacist or some type of chemist in California who made a synthetic fentanyl, which, if you don't know what that is, it's a very, very, very potent opioid medication that the pharmacists, that a lot of the anesthesiologists use. It comes in a patch, and if you're in chronic pain and use a patch, and that's fentanyl, it's thousands of times stronger, milligram per milligram, than morphine or oxycodone. But that being said, he made a synthetic fentanyl, and the patients that took that, it wiped out their basal ganglia and areas in their brain, and they all became Parkinson's patients. So that is one of those sad things. That's why you don't want to experiment with street drugs, because you never know what someone has put in their own their so-called chemistry batch. It's a very dangerous process. But anyway, chemical dependency. You're using a product, you become dependent on it. When you remove it, you basically have symptoms of withdrawals. Addiction is doing something despite the negative consequences of your actions. So sometimes people confuse the two comments, but let's break it down. If you are an addict, you know there's negative consequences to your smoking. There isn't a smoker out there in the world that doesn't know that he's hurting himself in one way or another. So therefore, yes, you are addicted to nicotine. You are addicted to a process. But nicotine addiction is both chemical and psychological, meaning there are things that you associate smoking with, such as eating, such as pleasurable things, even stressful things. And as a matter of fact, when I gave this talk last week, one of my patients works at the welfare department, came in and said, "You threw us under the bus because we're out there smoking." Well, it is what it is, meaning you're out there, and I do see it. And but it is one of those very powerful associations, and a lot of people will associate a lot of activity with smoking, and that's what makes it hard when you actually do stop smoking, because when you stop smoking, the nicotine is out of your system within 72 hours, meaning the chemical dependency part is gone within 72 hours. What's left is this mental association that's very, very difficult to break, because those activities in your mind that you associate with smoking, those mental associations still happen in your daily life. And that's what usually brings you back to using cigarettes. So that's why I like, when we talk about quitting, I like those vapor cigarettes, because they actually give you a break from the ritual by allowing you to actually reach for that vapor stuff right here. And everybody says, well, vapor's bad for you. Well, yes, ethylene glycol, which is antifreeze, is very, very bad for you in large amounts. It will kill you. But you're not really ingesting that, and it really doesn't get into your system in the quantities that can cause you damage. The other day I was in a casino, and I was playing some slot machine, and I sat next to a guy who was smoking a vapor cigarette, and I thought he was just literally going to take the stuff and pour it in a thing and do that. He just couldn't put that down. But it was better than sitting next to someone who was smoking. So anything to an excess is a major, major problem. So we're going to go to, let's see, the next slide. And I guess we brought that up last time, and I talked about it. But here are some of the benefits of quitting. And this goes from all the way from the first 20 minutes to years after quitting. Within 20 minutes of quitting, blood pressure and heart rate drop. So nicotine is a stimulant. It stimulates vasoconstriction, and it stimulates your heart rate. So if your heart rate goes up and your blood vessels constrict, your blood pressure will go up. And We tell patients if you have hypertension not to smoke at least 30 minutes to 1 hour before you get your blood pressure checked, or if you're a blood pressure patient and checking home blood pressures and you do smoke, please wait 30 minutes to an hour before you get an accurate blood pressure reading. Within 12 hours, carbon monoxide levels in the blood return to normal, and carbon monoxide makes your blood red, but it actually robs your body of oxygen. So your kidneys, when they are exposed to carbon monoxide, do not sense a high oxygen concentration. Therefore, they make more red blood cells. That process is called polycythemia. And when you're smoking and you have increased red blood cells, then you have what's called secondary polycythemia, secondary to smoking and lower concentrations of oxygen, even though your blood looks red. And as a matter of fact, if you have someone smoke and you look in their throat, their throat is very, very bright red. Almost looks like they have a sore throat, but it isn't. It's the carbon monoxide in their blood. Okay, and the next thing that happens within 48 hours, your nerve endings and your sense of smell and taste start to recover. Within 3 months, your circulation and lung function improve. And this is a very important thing about what smoking does to your lungs and how that takes time to take effect. And what smoking does is smoking is an irritant to your lung tissue. So it kills your natural mucus clearing mechanisms in your lung. And if it's just like someone who works with their hands, they have calluses, or someone who's out in the sun can get what they call a red neck. Your body responds to stress, and the same thing that happens in your lungs. But your mucus making mechanisms in your lung don't change. So you have nothing to clear the mucus, but you continue to make the mucus. Hence, the smoker's cough in the morning. You have to cough it up. And that process of thick mucus in the morning is what causes COPD, which I talked about in one particular show, where a mucus plug in your airway allows, as your lungs expand, air passes over the mucus plug. And when you collapse your lung, it collapses against the mucus plug, and therefore you trap air behind the plug. What that means is that if you had a balloon and you could blow into it and you could only let 50% out, guess what? Sooner or later the balloon will pop because there's too much air for that. The problem with that is our lungs are only in a fixed space in our chest. And if you keep blowing up all those little bitty balloons, eventually you blow it up into one bigger balloon and you reduce surface area for oxygen exchange, and you develop chronic obstructive pulmonary disease, chronic bronchitis. Emphysema is not really the same, it's used same, but emphysema is more of a inflammatory disease, but smoking does cause inflammation. And within 9 months, there seems to be a decrease in the cough and all the other symptoms. And within a year, there is a reduction in the risk of heart disease, almost back to where you were before you smoking. Anyway, we're going to go to break, and when we come back, I'm going to bring up the last improvements over the last 10 years of quitting smoking, if you can quit that long. And thank you for tuning in tonight.